Hello, everyone. Today we're going to learn about co-occurring disorders. Let's get started. Here we have a patient who has been diagnosed with a substance use disorder and a mental health disorder. We're going to talk about the benefits of treating both disorders instead of just one. But before we start, let's talk about what a co-occurring disorder is. A question you might ask is, why is it important to learn about this? Well, first, we want to raise awareness, and second, we want to encourage treatment. Raising awareness helps to provide knowledge about these conditions. People who experience a substance use disorder during their lives may also experience a co occurring mental disorder and vice versa. This also helps to reduce stigma. The more aware we become about these conditions, the better we are able to understand them. Raising awareness also helps to improve relationships. Co occurring disorders are not only affecting those experiencing the disorder, but they also have an impact on their loved ones. Encouraging treatment helps to first prevent complications. Did you know people experiencing co occurring disorders are more likely to be hospitalized than people who are only experiencing one mental or substance use disorder alone? It also helps to improve health outcomes. Health outcomes are enhanced for those living with co occurring disorders when treating all disorders involved rather than just one.
Today, we want to talk about the importance that you seek treatment for both substance abuse disorder and any co occurring mental health disorders. To start, there are many instances where substance abuse and mental health disorders go hand in hand, blah, 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 blah. I just want to see what.
Affordable mental health care can be difficult to find, so here are some options to consider. Graduate school clinics. Graduate school clinics train graduate students who are in the process of becoming psychologists. These students are monitored by licensed practitioners, and graduate school clinics may offer low and sometimes flexible rates. Unfortunately, graduate school clinics usually don't accept insurance. Training institutes. Training institutes train therapists that have completed their degrees but are working towards certification. Training institutes usually accept some types of insurance and often have reasonable rates for uninsured patients. Community mental health clinics. These are usually run by nonprofits and are likely to accept many types of insurance, including Medicaid and Medicare. However, community mental health clinics may have maximum income eligibility. Another option is hotlines. Hotlines are free unless otherwise specified. They are confidential and they are usually available 24 hours. Conventional mental health services may not be available everywhere, and telehealth may be a great alternative. What is telehealth therapy? Telehealth therapy is therapy delivered via video and/or audio conferencing. Why use telehealth counseling? Telehealth counseling enables delivery of mental health services in areas where such services were previously either difficult to access or unavailable. Does it work? According to a study published in 2022 where over 400 patients were analyzed, it was found that clients utilizing telemedicine mental health services achieved either clinically significant change or overall improvement after 3 to 7 sessions. Is it reliable? The delivery of mental health services using technology, such as teletherapy, has been implemented and investigated for over 60 years with an ever-growing collection of data. Is it as good as in-person counseling? Meta-analyses are emerging summarizing a mounting literature base and finding no statistically significant difference between in-person care and care delivered via telehealth.